One of the most common surgical emergency. A patient presented to us with sudden severe abdominal pain, like someone stabbed a knife in his abdomen. So this 35-year-old male who is a chronic smoker and history of chronic NSAIDs abuse presented to us with the features of very sudden onset around 30 minutes back, a severe abdominal pain which started in the epigastric region but now is in the whole abdomen. Now patient is saying he can't even breathe properly, and on vitals we have a tachycardia, tachypnea, and BP is 90 by 60, which means the patient is in shock, and temperature is also elevated. On examination, the abdomen is rigid like a board. Bowel sounds are absent, and on investigation, in the chest X-ray you can see there is gas under both dome of diaphragm. So, what do you think the diagnosis of this case is? Is it acute pancreatitis, hollow viscous perforation, most probably a peptic ulcer disease, acute cholecystitis, or something else? Yes, you guys guessed it correctly. This is a very common case of hollow viscous perforation, and most appropriate for this case is peptic ulcer disease, the perforation of peptic ulcer. So, what does this mean? It means that there is a peptic ulcer and now it has perforated. So, all the layers of bowel is perforated and the content of stomach and duodenum is draining inside the abdominal cavity, inside the peritoneal cavity. So, firstly, it leads to development of chemical peritonitis. In turns, it gets infected and bacteria grows in that and leads to bacterial and septic peritonitis. Usually, it occurs in either the first part of duodenum or in the prepyloric region of stomach. Common causes are H. pylori infection, NSAID abuse, steroid use, smoking, and sometimes stress. For the diagnosis part, clinical examination is must. When you palpate the patient with peritonitis with perforated hollow viscus, you can appreciate there is board-like rigidity and sometimes guarding is present. And in investigations, there is this erect chest X-ray in which you get air under the board dome of diaphragm. Gold standard test is CT scan, and for the management part, basic resuscitation must be done. IV fluids and antibiotics are must, and after that we need a midline laparotomy. Then find the ulcer, find the location of perforation, and if it is present in stomach or duodenum, then we need to repair it and do an omental patching, which means Gram's patch repair or a Selin-Jones repair. If there is some delay in the management of a perforated viscus, then mortality is very high. So this is a very important case, very important question for your surgical exams and vivas. So do share it, do save it, and do follow diagnose it for more such interesting cases. Thank you.